Chapter 21 covers skin and eye infections. We'll take the next few chapters of the textbook chapter by chapter, where we'll discuss the different pathogens and the infections that can result. And we will go through and look at bacterial pathogens along with viral, fungal, helminthic, if there are any, and protozoan infections. When we consider skin infections, the first pathogen that we're going to look at is Staphylococcus aureus. It is a normal member of the microbiota for most people, and as long as it stays on the surface of the skin, it's not going to cause any problems. It's when it gets where it's not supposed to be, underneath the surface of the skin, through a cut or a hair follicle or some other type of wound, that we really start to see problems. Staphylococcus aureus is a bad dude. You see there in its pathogenesis, structural defense against phagocytosis, so it's able to prevent our white blood cells from eating it or ingesting it. It produces a lot of different enzymes and toxins that allow it to invade tissues. Prevention: hand washing, of course, staying away from people that have staph, or, washing your hands and avoiding close contact with people with a known staph infection. And the treatment really depends on the type of staph. A lot of times once a Staphylococcus aureus infection is detected, then there'll be an antibiotic sensitivity test done to determine what antibiotics can be used to treat it. So Staphylococcus aureus is a gram-positive staphylococci. So you see here purple cells in clusters. That's characteristic of all Staphylococcus species, but of course Staphylococcus aureus in particular. So one of the most common staphylococcal infections that we see is impetigo. Impetigo is a superficial infection. It is just the first layer of the skin really that's damaged. It doesn't get into the deeper tissues and cause deeper damage. It creates these little sores that ooze and scab over, and if kids scratch or pick at them, they tend to spread. And where we really see these is around the nose or the mouth, particularly among young children who may have had a runny nose and they rub their nose constantly, and then the staph gets into the skin and causes this impetigo. Other places you might see it are around bug bites, again, particularly in young children. They scratch, a bug bite, the staph gets in there and causes the impetigo. You see here, I've got a note. It's annoying, but not particularly serious because it doesn't invade those deeper tissues. Some topical antibiotic ointment, something like triple antibiotic ointment, will typically clear up impetigo with no problem. Now, a more serious form of staphylococcal infection is scalded skin syndrome, and it's called this because it looks like blistered skin. It looks like skin that has been burned. Basically, the skin starts to peel away, and this is caused only by specific strains of Staph aureus that produce what's called an exfoliative toxin. So the pathogen gets in, starts secreting this toxin, and causes the epidermis, the outer layer of the skin, to slough off. The issue with scalded skin syndrome is it's painful, for one, and it opens the door for other type of infections, these secondary infections, because now that the outer layer of the skin is gone, we've lost some of our protection from invasion of pathogens. Folliculitis, or an infected or inflamed hair follicle. Very common. You see these. They look like little pimples or bumps surrounding a hair follicle, usually self-limiting. A lot of times you'll see this, you know, on a guy's face where he shaves, or in the inguinal or groin region, or even on the legs from shaving is where it typically occurs. You shave, get an ingrown hair, and an infection kind of starts up in there. And these will typically go away on their own. But sometimes if there's a lot of them, as in this case, or if it continues for more than a few days, then you may need some type of topical antibiotic treatment. Now, a furuncle or a boil is a deeper infection. Now we're going below the epidermis. We're getting deeper into the dermis and even below the dermis. And these are very painful. They're like the swollen hair follicles, but they're a lot bigger, a lot more painful. And typically see these in kids who play sports because, you know, they're sweaty and they're not in the most hygienic of places, and they're not the most hygienic themselves in terms of taking showers and baths. People who live in really close quarters with one another and may not practice good personal hygiene also are susceptible to these. They a lot of times will resolve on their own, but if they become too large, then it will be necessary to go to the doctor and get them lanced or drained, and then potentially an antibiotic treatment. Now, a carbuncle is when several boils or several furuncles merge together, essentially. And this invades deeper and can really even become systemic. They can lead to fever. They can lead to an overall feeling of malaise. There's a lot of infection in there. They usually have to be drained and packed and then watched very carefully. The person would definitely receive some type of oral antibiotic, maybe also a topical antibiotic, and they would have to be seen by the doctor periodically. You can see from this image that, you know, there's a large area that is red and swollen and indicative of an infection. Streptococcus pyogenes can also cause some similar skin infections. Typically, Streptococcus pyogenes is more a member of the throat or the nose, even not as much on the skin, although it can reside there. And again, just like with the Staphylococcus aureus, doesn't typically cause disease unless it gets somewhere where it's not supposed to be. Okay. Just like Staphylococcus aureus, Streptococcus pyogenes inhibits phagocytosis, produces enzymes, and also produces toxins. This is another bad dude that can cause a lot of different types of infections. Fortunately, though, for the most part, streptococcal skin infections can be treated with penicillin, and we don't have to resort to the stronger antibiotics. So one type of streptococcal skin infection is called erysipelas. Erysipelas is similar to cellulitis, but the lesions are raised, and there's a clear line of demarcation between the infected and inflamed tissue and the non-infected. So you can see this lesion here on the side of the face, kind of under the eye. This would be swollen. It would be painful. There would be very bright redness, as you can see here, and also warmth. So this would be hot to the touch. Now, the one type of infection or disease that Streptococcus pyogenes gets a real bad rap for is the so-called flesh-eating strep or necrotizing fasciitis. What happens with necrotizing fasciitis and it can be caused by many other bacteria other than strep, is that it gets into the skin, typically from a deeper wound. This is going to be some type of gash or injury. You're not going to see necrotizing fasciitis stem from, a bug bite or a paper cut. This is going to be something that is going to be a much deeper wound, and the strep starts to invade the underlying tissues. In a lot of cases with necrotizing fasciitis, it will go all the way to the bone, and amputation is typically the only means of survival with necrotizing fasciitis, just because it spreads so quickly. Okay. Now, we'll talk about Bacillus Anthracis, the causative agent of anthrax, in a couple different chapters because it has more than one manifestation. It is, as its name implies, a rod-shaped bacterium. Here we can see it in a blood smear. You see your red blood cells, or the pale blue round structures, and then we have the Bacillus Anthracis there. You can see the kind of purple. It is a gram-positive bacterium. And one of the manifestations of anthrax is called cutaneous anthrax. And this enters through a break in the skin. Typically, this is going to occur in individuals who work around animals, sheep, or cows, horses. Okay, it's going to enter in through a break in the skin, so there has to be some type of existing wound. It secretes a toxin, and basically it causes this nodule around the site of infection, and the bacteria start to grow within this sore, and they release a toxin into the blood. Fortunately, it's very easily treated, and even untreated, it's only fatal 20% of the time. So this is the mildest form of anthrax. So here we see the sore that is going to result. You see that kind of raised area around the sore, and eventually it will turn black. And this is going to take several weeks or even months to heal. Now, moving on, we have Otitis Externa. So Otitis Externa would be an inflammation or infection of the external ear. And this basically means the ear canal. So from the opening of the ear down to the eardrum. Typically, this is going to result from going swimming in water that is not clean or chlorinated. So, lake water, and bacteria get in there. Pseudomonas aeruginosa is one that is implicated a lot, but there are other bacteria that can cause otitis externa. Inflammation of the outer ear and the ear canal. It's going to be painful. It's going to be hurt. It's going to hurt to the touch. It may be red. It may be warm. Antibiotic ear drops are the best way to go, or you can buy. It's really just called swimmer's ear drops, and really what it is it's alcohol in a little dropper bottle, and you can put that in your ear after swimming to kill the bacteria, to prevent it from causing the otitis externa. If you develop this type of infection, it does usually take an oral antibiotic to get rid of it completely. You see they're treated with the combination of aminoglycosides and beta-lactams, because Pseudomonas has a reputation for being resistant to different types of antibiotics. You see it here as a rod-shaped bacterium, so it is a Bacillus bacterium. And here is just an example. So this would be the normal ear. Here's the swollen ear. You can see how swollen the outer ear canal has become, even into this part of the ear, how swollen it is. And that would be very painful to the touch as well. Conjunctivitis can be caused by a lot of different things. There is viral conjunctivitis and bacterial conjunctivitis. Typically, viral conjunctivitis is caused by adenoviruses. There are a lot of different bacteria that cause conjunctivitis, and normally it's not cultured to determine what it is. These bacteria are typically susceptible to regular run-of-the-mill antibiotics. So, contact with infected droplets. So someone, could rub their eyes and then touch something through fomites, and you touch it and touch your eye. Contaminated water, sneezing, coughing. Redness is the main symptom. Increased tear production, so their eyes are going to be watery. They're going to be itchy. They may be painful. Pus is only present in bacterial conjunctivitis. So if there is no pus present, if there's just a clear, tear-like discharge from the eye, that's going to be viral conjunctivitis. If there is pus, then that's going to be bacterial conjunctivitis. Viral goes away on its own for the most part. Lasts a while, a week to 2 weeks, highly contagious. But for bacterial conjunctivitis, antibiotics are required. So these are some extreme cases here, but I wanted you to understand the difference between the two. So viral conjunctivitis, that's what we commonly refer to as pink eye, because the eye will turn bright red, it may be swollen, it's going to be really itchy, it's going to be really watery. Bacterial conjunctivitis also going to be red, and this again is a severe case of bacterial conjunctivitis. But notice the discharge here is white. This is a purulent or pus-filled discharge. The eyelid may fold in on itself. And what's going to happen is as the person sleeps at night, the eyes are going to mat up. They're going to mat together so that they end up having to basically wash their eyes to get them to open in the morning. Bacterial conjunctivitis must be treated with antibiotics. If not, then it can lead to complications, including blindness. Now, HPV, this is human papillomavirus, and we'll come back to this again when we get to our sexually transmitted infections, but human papillomavirus causes warts. And we have over 70 different strains that cause warts, on the body. Don't really know exactly how it does what it does. Avoid contact because that seems to be how they spread. There is no cure. Once you have the virus, you're always going to have the virus. You can get the warts removed, but there's no guarantee that more warts won't come back. Now, all warts on the body are caused by HPV. We tend to give them different names based on where they're located. So, seed warts on the fingers or toes, in the soles of the feet, they're typically deeper and larger. We call those plantar warts, and pretty much anywhere else we call flat warts. So, here's an example of plantar warts. These tend to be larger and deeper. Seed warts you see typically very tiny. That's why we call them seed warts. Another virus that we'll come back to later on is herpes simplex virus. In this case, we're looking at oral herpes, not genital herpes, and typically they are caused by HSV1, herpes simplex virus 1. Direct contact is the only way that they are spread, and this leads to what we commonly refer to as fever blisters or cold sores. Now, about 2/3 of patients who have HSV1 will experience recurrences. So that means that 1/3 of people who are infected may have an initial fever blister, an initial outbreak, and then never have another one, or they may not ever have one. They may never know that they are infected. There is no cure. Once you have it, you always have it, but there are some over-the-counter topical medications that are available: Abreva, Zolactin, Lysine. So here's a picture of a fever blister. small blisters that form around the lips. The herpes simplex virus lives on the trigeminal nerve, which is the major nerve that serves the face, and one of its branches goes to the mouth. And so this virus experiences latency, it remains dormant, and then at various points can become triggered. Typically it's triggered by stress or sunlight in some cases, already being sick, running fever. That's where they get the name fever blisters. But every person is different in terms of what causes the virus to become active again and cause a fever blister. Now, Erythema infectiosum, otherwise known as fifth disease, has been around for a really long time. It got its name, fifth disease, because it was fifth on the list of childhood rash-causing diseases. It's caused by parvovirus B19. It's a completely different parvovirus than what we see in dogs. It is transmitted through droplets, and vertical transmission is possible. Causes an anemia and a rash. And the rash is triggered by the immune response to the virus. So as the immune system starts fighting the virus, it produces this rash. So you've got fever, headache, just an overall feeling of malaise, and then the rash starts on the cheeks and then starts to spread over the trunks. And there's really nothing you can do. You can treat the symptoms, treat the fever, but that's all you can really do. Sometimes fifth disease is also called slapped cheek syndrome, because when the rash starts on the face, it starts on the cheeks and turns them bright red. It looks like the child was slapped in the face. And then the rash over the rest of the body is red and kind of a lacy appearance. Roseola is another rash-causing disease, also caused by a herpes virus, transmitted by droplets. And roseola is known by its sudden high fever. The child is feeling fine. And then all of a sudden they're running this really high fever that is hard to control. And then after the fever, here comes the rash. And they may not have any other symptoms other than the fever and then the rash. Starts on the trunk and spreads outward. The thing you have to worry about with roseola is the fever, especially in really young infants and children. Typically starts on the back or the trunk and spreads outward from there. It's a really faint rash, typically not raised.